So thank you very much to Kurtisha for having me and Hina as well. And Hina initially wanted me to talk about the menopause for an hour. And I meant, menopause for an hour on Monday? Like, no way. I thought it would be probably more beneficial to have a bit more comprehensive talk. So we will talk about the menopause and then do some extra things as well. And so we're going to have 4 little topics today. We'll have the menopause and breast cancer, which I thought would be useful for that's the commonest cancer in women. And then also we'll have the health screening tests and the cervical smear. And we have Mrs. Dada to assist us with that. She's an experienced health visitor and a registered nurse, and this is obviously her bread and butter. So she'll probably be better than me to do that because they do more of it than we do as GPs. And then what I thought would be helpful, because obviously it's quite a lot of topics to go through, is after each section, just stop for a few questions, and then at the end, then we can answer a question. I think it's very important when women come together like this and you have a health talk, that you get the questions that you really think are in your mind, just get them out, because obviously I appreciate that it's not that easy to get to see your GPs these days, and we're always in a hurry. But this is an opportunity, an informal way you can sort of talk about things that are bothering you, and time permitting, we'll go through as many as we can. So as Hina alluded to, women these days are doing all sorts of things. We're very busy on the home front. We're caring for children, husbands. What will they do without us? And we're also caring for elderly relatives. More, it's becoming an issue now where people are coming and having to care for elderly relatives, and it's quite hard to juggle it all. And again, women are taking their role not just in the home but also on the world stage. So we have obviously Prime Minister is female, Queen. We have lots of world leaders and people in professional roles as well. So I think it's very important what you're doing here, trying to get your health addressed and sort of be aware, because information is key. So without further ado, we're just going to the menopause. Now the menopause is a bit of a misnomer, because when we say menopause, it's not like your TV remote control where you just press pause and it stops. It doesn't work that way at all with menopause. But the menopause is more, actually it's a diagnosis we make in retrospect. So what does that mean? So when a woman is coming up to the age of 51, so you can start anything from 45 onwards, you find that your periods, if they were regular before, maybe every 28, 30 days or what have you, you find they're not as regular. So they're either coming in, taking a longer time to come up, and then coming and lasting longer, or the opposites. You're like, oh, period, where's my period this month? And obviously you're not pregnant because you've checked, hopefully. and so you don't have a period, and you just sort of wonder what's happening. So what happens is, for the first 2 years or so, around that sort of age, so average age in the UK, this data is based on Caucasian women. So obviously ethnic minority women might be slightly different. But we usually say about 50 to 51, and you would find that you're getting this waxing and this waning and waxing and waning, and where is it not? But what happens is, if you now don't have a period for 12 months, then you can look back and say, I'm now in the menopause. And it's important to remember that 12-month mark, because if you then get a bleed after that, that's called a postmenopausal bleed after 6 months after your menopause, and that can be an indication of some serious illness. So you need to be aware of when you've had the menopause, and then if you get any sort of bleed around that time, it's always best to see us. And we always fit such women in very quickly, because we want to make sure there's nothing untoward going on. So when I used to work in Hampstead Gardens, I had a lot of Caucasian patients, and they hated the menopause. And they absolutely dread it. And some people just get on with it. Some people don't, but nobody ever celebrates them. Oh, I'm in the menopause. You don't hear that at all. So I just wondered, how do you regard it? I mean, what's your experience? Is it a big deal? Not an issue. Okay. So I don't know if this is going to work. I had a little clip, but are we connected to the internet?
No.
No. Okay. So basically, you can just look this up later. This is healthtalk.org, and it was just a really like 1 minute clip of different women just saying how they went through the menopause, and it's quite interesting. But I will touch on those things there. But it's just an interesting thing. I thought if we had internet, I'll show you. Now, believe it or not, someone's making money off the menopause. So this is a card that you can actually send to your friends, and that's the envelope to post it in. And actually, it's a bit of humor, which I think is always good, to have a bit of humor, not to take life too seriously. But actually, it summarizes the symptoms of menopause really well, because the first two up there, one is itchy, the other one is bitchy, and then there is sweaty, bloaty, sleepy, forgetful, and psycho. And just remember psycho, because we'll come back to her later.
Psycho is the worst one.
It is the worst one, yes, definitely. So why does the menopause happen? So obviously nothing can go on forever. So as women, we get into puberty, we start to be reproductively active, we're ready to have our families and what have you. And the good thing is that it all stops at some point, so you've got to have a break from that. So what happens is that the estrogen levels are now being reduced because you don't need it anymore, you don't need to be in the reproductive phase anymore, and that's why you start to get other symptoms of menopause. So basically it's a phase of life, so you get there, you have your puberty, you're reproductive, and about the age 45 upwards, things that sort of peter out a little bit, and then you get to the pause as we talked about earlier. So basically the hormone that is reduced then is the estrogen hormone, okay? Now unfortunately some women before the age of 40 may have this premature menopause, which could either be due to just idiopathic, we don't really know what causes it, or if they've had to have surgery or some sort of cancer or some treatment with chemotherapy, then it might be induced in them. So if they have, so they might have premature, so that's called the premature menopause, because I said menopause is something that would happen but premature. So obviously the symptoms now you're going to get are due to the fact that you don't have enough estrogen. So there's hot flushes, the night sweats as we saw in the card. Now, because estrogen not only supplies our reproductive tract, it also supplies our urogenic structure, so basically the bladder and things that help us to have to pass urine, basically. So reduced estrogen then means you get dryness down below in the vaginal area, you get women getting more frequent urinary tract infections, so you find that, oh, I was fine before and now I've gone to menopause, I seem to be always having a urinary tract infection, so that happens. Then the other thing obviously is that the dryness and then the low libido, they may affect intercourse, because obviously it becomes very painful. You're not as lubricated as you were, and you might find that the PCB, that just means postcoital bleeding. So basically you're having intercourse and you get some bleeding afterwards. That's because that area is a bit dry. So these are things that you may notice in the menopause. And then the other thing is to bear in mind is that obviously the bones get thinner as well. And that could also be hampered by if you already had osteoporosis or any sort of bone conditions as well. And then the psychosocial, which as you said is the most important, is the mood swings and the teariness and just feeling low and just feeling very unworthy. And it can be difficult for some women who go through that and being forgetful as well. So I remember one of our colleagues would be having a meeting and she'll say, oh, I'm getting the senior moments here. And we all knew what that meant. She couldn't remember what she was going to say. And I think I'm beginning to get a few of that as well. So, and then also the increased risk of heart attack. I know you wanted me to touch on that as well. That's because when you have a lot of estrogen, it helps us to keep the good cholesterol high and the bad cholesterol low. So what happens obviously when you don't have the estrogen, then you might get that reversal. Obviously these are things that also depend on other things like what you eating and the cardiovascular risk which you might have by benefits of your genes or family history and what have you. So there's the increased risk of, it doesn't mean because you're going through menopause you're going to have a heart attack. So please, it's just saying that you have an increase because that protection is removed, okay? Then the generalized pruritus just means itching a lot. So just to reiterate a bit, because I think this is where menopause gets its bad name, is the mood. So you just imagine this lady in about her 50s. So she's probably about, doing well in her career. By the time you're 50, sort of more or less you're settled, aren't you? Sort of like, you've gone your career path and probably you're managing departments or you might be, if you've been a homemaker, you probably have older children, teenagers who are very unuseful and I don't really care about anybody else, sort of in their own world. So you can imagine this woman going through all these sort of symptoms we mentioned, sweaty, itchy, bitchy, sleepy, whatever, dopey, forgetful and psycho, and then dealing with perhaps a husband going through the midlife crisis, and then you now have the children who can't be bothered, and then you now have work. So you can imagine that woman is not only a nightmare for herself, but she's also a nightmare to be around, don't you think? She's a nightmare to work for, she's the boss, she's a nightmare to be a friend, she's probably always weeping and everything, so it can be difficult. And again, if you're getting lots of night sweats and hot flushes and you can't sleep properly, you can just imagine the exhaustion. And nowadays life is so unforgiving, isn't it? We've all got to be able to get up and go and do this and do that, multitask, and it is getting a bit much on women. And so she finds that she can't cope. So ADL means activities of daily living, so you just find you're just struggling. I mean, I have a lady who is 45, 46 now, I think, and she came to me, said to me, she said all her symptoms and we realized it was the premature menopause. And then after lots of consultations, because it's not something you can just decide in 10 minutes, she gave her things to go and read and check. And she said that she was just going to go on the HRT. And I said, you know what, you're less than 50, you should be on the HRT because you're being shortchanged. Everyone is getting up to 50 and then I said to her, go on it. And she came back, because I bring them back for reviews. And she said to me, Do you know, even my husband says thank you because, she was so much, and she could cope with her family. She had 2 young children. She could cope, and that's what it does. It really helps. And then obviously, if the lady has gone through menopause and was sort of hoping, because people are sort of leaving off getting married or getting settled down much later, either due to choice or career or not even finding the right person, as someone said. So if she now finds that, oh my God, I've gone to the menopause, it is devastating. I have someone like that as well, and I felt really sorry for her because something she was hoping that she would get round to and do. So it becomes a lost opportunity. And then again, the people might feel unattractive, shriveled up. Someone said everything going south, no longer feminine or attractive. So this is the menopause for you. So how do we treat this? So you'll be pleased to hear there's a pill for every ill. So like the menopause, that video I was going to show to you, which we didn't get to see. One lady said, I feel like a bit of a fraud, really, because menopause, what menopause? Some people just, nothing. It's like, oh, okay. Did it happen? Okay, you must have. Well, so if it's not a problem for you, then don't do anything. You don't have to take a medication. It's like I said, it's part of life. So you can just grin and bear it. These too shall pass, as we say in our circles. And then if you have symptoms that a bit difficult, like that cycle lady. So I remember when I was many years ago, I had this lady and she came to me. She was trying to convince me to give her menopause, and this is when we're still a little bit reticent about giving it because we had this WHI study, which is like a study that sort of did some research that scared everyone about menopause and HRT rather. And she said to me, please, please, please. And the only thing that made me give it to her, said, I feel like killing my husband. And I said, never mind you. I want to save your husband. Because I don't want to be on the news and they say, oh, the patient has killed her husband because she was psychic or whatever. So we had a little laugh about it. And I said to her, don't worry, we will save your husband, we'll treat you. So she got medication. So as I said earlier, that certainly if it's a premature menopause, then they should really be on it. But obviously, today I was just saying to Dupe that I had a request for 2 patients. One is 64 and she wanted more of her HRT patches, and the other one is 72 and she wanted more of her HRT patches. And I said no, because I hadn't seen them before and nobody had checked on them. So they sort of got just left on it, which is safe, but it's never really too safe. You should really be checking on them, bringing them back in, doing little checks. So I said to them, just come and see me, let's have a little chat about this. So basically the point I'm trying to make is that women do go on this for a long time if they need to, and that's the point. If you need to, if you're low risk, you've done anything else wrong, because the reason why is because 2% of breast cancer, which is our next topic, is caused by prolonged HRT. So you can imagine someone who is 64, she went through menopause ages ago, she should really be thinking about whether she needs it or not, and she may need it, because when I used to work in the menopause clinic at the hospital, we did have patients in that age group who had difficult menopause, suffered a lot, and so we had to treat them. But I think it's a case-by-case basis, but most women sail through it. We have 8,000 patients, don't make it, and we don't see that many with menopause, so it's not a very common thing, maybe because people don't talk about it, we don't know, but if you do suffer, there's help at hand. If you are less than 50, definitely I would say please go on it, because otherwise you're going to end up with osteoporosis, if you get shortchanged with your estrogen. And if you have to go on HRT, the safest way is a patch. So it's a patch, waterproof patch. You just put it on there, change it twice a week. If you don't like the idea of a patch, maybe you have an allergy to plaster or something, or you have hairy skin, it doesn't stick on, you can go on tablets. If the problem is mostly intercourse, so it's down below, is a dryness, and that's your main problem, you're not really complaining about the hot flushes or anything, then in that case, just use localized treatment, just the creams, other lubricants and things. So let's see what we have on next. So yes, some people are very anti-HRT meds, and that's fine. I get that. And so for them, it's like this lady, keep cool. So basically, I have another lady. She's how old is she? She said to me, and I sleep with the fan on, and I look out of the window because when we had that cold spell, I thought. And she said, and my husband, and before you ask me, I'm still married and he sleeps with me in the same room with the cold. I'm like, oh. And she said he's learned to deal with it. So basically, if you don't want to go on medication, just do something to keep yourself cool, relax. If the mood is the problem, you can go for some counseling. As I said before, if intercourse is the problem, vaginal lubricants can help. St. John's Wort is something you can buy over the counter. It does help with depression and low mood as well. But be careful if you take other medication, because it has a whole list of medication that it doesn't go well with. So just be careful about that. And there are things like ginseng, black cohosh, red clover. all these sort of alternative therapies, we as doctors don't know that much about. So that's be my disclaimer. That, but I do know that the health shops say that it works. So if anyone has tried it and it works, come and convince me afterwards. And then there's something called yam. Do you know what yam is?
Yeah.
So yam has phytoestrogens, and many people that eat yam, would keep looking supple. So there might be some truth in that. So I think at this point, my summary is that, like death and taxes, the menopause is coming as long as you live long enough. And I think my suggestion is that, don't be scared about it if you haven't been through it. Just, it's going to happen. Just get on with it, as Theresa May will say. And it is a time, to sort of put back that period of life where you were having children and getting pregnant, having periods and what have you. And just see it as a new phase of life when you can do mountain climbing and whatever the things the WI women are always doing. And then further, if you want to learn more about it, obviously the NHS has a nice leaflet on menopause symptoms, which you can always address online. And I'm happy to now take questions on the talk, if any. Okay.
So how long do the symptoms normally last? Is it, is like you said, 50, 51 is the age. Is there kind of an average of, does it last a few months to a few years? Or
That's a good question. Excellent. I forgot to mention that. So usually the period around the menopause is the perimenopausal period or climacteric in medical terms is 1 to 2 years. But every woman is different. Some people might just be breeze, and then some might unfortunately be suffering even in their 60s and 70s. I had another lady actually. She's an Asian lady actually. She's 64, 5. She came last year. She really struggled. I think it was the night sweat that was her issue. And then she said to me, so she was very reluctant to start. I think she had done alternative and she wasn't. So I said, okay, do you know what? We've had a chance. Let's look, just try it for a few months. And let's see, you're quite low risk, blah, blah, blah. So we did that. And then the next thing she comes to see me, oh, Dr. Gomo, I'm going off to, where was she going again? Once exotic place. And she came back. And she came back again. She said, oh, Dr. Gomo, I'm going. I said, you keep traveling. She's having the time of her life. She has so much energy. She was looking very pretty, very young. I said, oh my word. I said, you just take me one of your trips. Oh, Dr. Gomo, I'm busy. I'm going somewhere. So the point was that she was doing well. And then she came to see me a couple of weeks ago. She said to me, oh, now I want to stop. Now I'm fine. So she was only for 10 months. So she's going to stop now. So I think the thing is, if you need it, it's going to make your life better. The patient who was 70-something, another patient of mine who had it and who begged me, she said to me, look, I don't care. I just want to enjoy the life that I have. Without it, life is miserable. I want a quality of life. I don't care, but I know the risks. And as long as the patient is like that, Compass Mentors understands the risk, wants to have a try, and there's nothing overtly wrong, but she couldn't have it. You're just being like ageist, so to speak, and saying you're old. No, we're now encouraged to just prescribe and let the patients, see how they get on. But obviously review them at least once a year. And that's why those other ladies are getting called in, because no one's seen them. All right, any other questions?
How do you actually do your levels? Is it through a blood test? Or?
That's a good question. So the nice guidance is after 45, we don't do levels.
Okay.
So we're just going to go by how you're feeling, your symptoms. But if you are younger and you're getting what we think are menopausal symptoms and we're not sure, then we do levels to see whether your hormone levels or your FSH in particular is one we're looking at has dropped. But if you're of the age, as I said, when we expect it to happen, then we don't need to go testing for something that we know is going to happen to everyone. So we don't do that. The caveat for that is in patients who are on hormonal contraception. So for example, people who are on Mirena or are still on the contraceptive pill, because they are taking hormones, they might be masking things a little bit. I mean, they won't be absolutely sure. Then we might do blood tests for them. This is a one-off, but not really. We don't really use blood tests after the age of 45, and that is nice guidance. Any other questions?
Does going on HRT increase the risk of breast cancer?
Yes, it does. So I was saying earlier that a 2% risk of 2% of breast cancer cases will be due to HRT, which is why you choose your patient carefully. Obviously, someone comes and says to me, there's breast cancer in my family. I'll be like, sorry, go and try some clover or ginger or something. You see what I mean? So, but if someone comes and says there's no such history in my family, and it's absolutely fine. You do the breast examination, which we'll talk about in our next talk, and you can try it for. You're not going to get breast cancer from what we know. Obviously, research keeps coming out. If you try HRT for a year or two, it's normally the people who've been on it for years and years that have. So your risk comes with the duration of use. Does that make sense?
It's just that I was on HRT for about 20 years.
For 20 years. Oh. Oh,
I had forced menopause basically.
I see. Okay, so you had to go on earlier. Yes, yes. Yeah. Well, you look good. You still on it.
She's like your traveling lady.
Yeah, she's always going around. That's nice. So any more questions?
If somebody had hysterectomy done,
Yes.
can they still go to
That's a very good question.
Yeah.
So, because when we do HRT, the hormone replacement therapy is 2 hormones. So you give both the estrogen and progesterone. So, like I said, the symptoms you get were due to the estrogen. But if the woman has her womb in place, then she needs both estrogen and progesterone to counterbalance the other one. But if she has no womb, then she just goes for the estrogen only.
And is that still a patch if it is just estrogen? Or
Yes.
is
So
it,
yes. So then you get the overall patch. Yeah.
And I have
And you
another
try and use
question.
the lowest dose. That's
Okay.
yeah. Do the lowest dose that can minimize. So you try the lowest dose first. Everything's all done to be safe. And if the low dose, sorts you out, then fine. There's no point going to a big dose if a small dose would do.
And night sweats, is it always just at night or that they do happen anytime?
Well, that's a good question. I think it's mostly at night because I haven't heard anyone saying about sweating the day. But what they tend to say it happens anytime is the hot flush.
Yes.
So you just sitting like a whoosh. I'm told. Yeah, so that can occur anytime. But I think nights are more at night. Yeah. You have a question?
Yeah, I was going to ask, I know some friends who talk about it and say actually anxiety is a big thing as well during the menopause. Is that something you've come across or not?
Not really. I mean, what are they anxious about? It'd be interesting to know because are they just anxious that they're getting all this? Because sometimes, that change in your body and not being aware of what's going on. And that's why I think what you're doing is brilliant. Being aware of, what's to come, basically, if it hasn't come. And, if it has come, that's what I was going through at the time. It's important because if you don't know, then you're still like, anxious. You're not sure what's going to happen or how long it's going to last for, like you asked. So these are things that are important. Yeah. In fact, I was invited to a marriage seminar. That's a little story. I like telling stories. And then when I got there, this is a Pentecostal preacher, and he's meant to be talking about marriage seminar, and he talked about the menopause. He did a brilliant talk though, and I wondered why. He said because they need to understand their wives.
Yeah.
Because don't forget, at that time the marriage is like 20 years, whatever. Everyone's getting a little bit stale, and you don't see this woman changing, beachy, this, sweating. Should I be swapping her for someone else? So he did that to sort of teach them what their wives were going through, and so you can get support. Because it's a time, if like I said earlier, these two shall pass. If it's going to go, and the husband thinks, okay, we just need to greet and bear it, she will come back to me, then that's probably easier.
Yeah.
But obviously, if he thinks, oh my God, what's happened to her? Then it's a process. I think it was a good move on his part to do that, to teach the men. So go back and tell your husband.
I think we should have invited the
You
husbands
should have
to this
invited-
one.
Exactly. Yeah, definitely. So
How would you deal with maybe let's say after 8 to 10 years having gone through your menopause and then you still get all the symptoms?
All the symptoms.
Well, not all, part
Yeah.
of the symptoms.
Then you can get some treatment, maybe for 3 months, 6 months.
Like what?
So any of the HRT,
Oh, okay.
yeah. So in the patches, depends on what symptoms a person has. It's an individualized treatment. So you obviously have a chat and you say which one is your problem. If you're getting what we call the vasomotor, so the flushes, the night sweats, then you need estrogen. Okay, so that could just be the patch. Is the safest way to take it. But the patch is going in through the skin, so transdermally, as opposed to taking it by mouth and going through your whole system. Okay, so but if the problem, as I said, is just intercourse is a problem, you're feeling dry or low libido, then you could try the estrogen creams. You see what I mean? So basically, if you come and see us, have a chat with your GP, and it might be something that they'll come, they will speak to you, give you a leaflet to go and read. And then you'll say what is your issue, what do you really want sorted out, and then you just try it for 3-6 months even, As I say to my patient, I'm giving you the prescription. Once I give it to you, it's yours. It's in your power. If you don't want to take it, because it's a tablet. If you don't put it in your mouth, do you see what I mean? But at least go and have that conversation. Don't suffer in silence. I don't think it's worth it. With 21st century living, you really need your energy. Okay, so I think should we go on to the
One friend, she's under 45 and
Right.
her periods has stopped.
Okay, completely.
But she,
For a
since
whole
when
12
we
months?
talk,
Okay.
and but she feels very normal. There are not any mood swings or nothing.
Nothing.
And even physically she feels normal. So what to do for that?
So like I said, so she falls into the premature menopause. So she's not really going to, they don't tend to get any bad symptoms per se. Don't forget they've still had estrogen all this while. So she will be fine for a while, but she might start to feel it later. So she might be a good, I mean, I'll probably say, I don't know her, I don't know her history,
Yes.
well, probably HRT is not a bad idea for her. Like I said, if we're based on the UK, where the average age is 51, 50, so, you know, she's obviously going to get 5 years not having estrogen, even for her bones alone, for bone protection, so that she's not at risk of osteoporosis should she fall when she's an older person. Obviously, if you have osteoporosis and you're an older person through the menopause,